Ladies and gentlemen, please rise as we welcome the Premier of the Turks and Caicos Islands, the Honorable C. Washington Mizik. Please continue standing as we welcome Her Excellency the Governor, Delini Daniel Selvaratnam. Thank you very much. Please be seated. Her Excellency Delini Daniel Selvaratnam, Governor of the Turks and Caicos Islands, the Honorable Charles Washington Mizik, Premier and Minister of Finance, Economic Development, Investment and Trade, Her Excellency Anya Williams, Deputy Governor and Head of the Public Service, the Honorable Sean Malcolm, Minister of Public Safety, Gender, Religious Affairs and Social Welfare, the Honorable Rachel Taylor, Minister of Education, Youth, Sports and Culture, and the man of the hour, the Honorable Kyle Knowles, Minister of Health and Human Services. Our distinguished partners and stakeholders, His Excellency Mainak Joshi, High Commissioner of India to Jamaica with responsibilities for Bahamas and the Turks and Caicos Islands. Please note that some of our distinguished partners and stakeholders are joining us both in person and online. Dr. Jabas Barbosa, Director, Pan American Health Organization, PAHO. Dr. Rhonda Seeley Thomas, Assistant Director, PAHO. Dr. Eldona Boson, PAHO WHO representative for the Bahamas and the Turks and Caicos Islands. Ms. Luisa Cabal, Regional Director, UNAIDS, Latin America and the Caribbean. Dr. Josie Dion, Chair, Regional Validation Committee. Ms. Anurita Baines, Associate Director of HIV and AIDS, UNICEF. Ms. Wendy Taup Emanuelson, Executive Director, Pan American Partnership Against HIV and AIDS, PANCAP. Our local partners and stakeholders, Mrs. Desiree Lewis, Permanent Secretary, Ministry of Health and Human Services, Ms. Renessa Williams, Deputy Permanent Secretary, Ministry of Health and Human Services, Dr. Nadia Astwood, our Chief Medical Officer, Permanent Secretaries, Deputy Permanent Secretaries, government officials, Reverend Desiree Johnson, TCI Ministry of Health, ladies and gentlemen, members of the media, well-wishers, good morning. Welcome to this truly historic occasion as we gather to celebrate an achievement that will forever be recorded among the most significant public health milestones in the history of these islands. Today is not simply about receiving a certificate. Today is about recognizing decades of dedication, determination, partnership, innovation, and an unwavering commitment to protecting mothers, babies, and families throughout our islands. In just a few moments, we will officially commemorate the certification of the Turks and Caicos Islands for the elimination of mother-to-child transmission of HIV, a remarkable accomplishment that places our nation among a select group of countries and territories worldwide to achieve this gold standard in public health. Today, we celebrate more than a public health achievement. We celebrate healthier pregnancies. We celebrate safer children, and we celebrate strong healthcare systems. This accomplishment reflects a year of commitment from healthcare professionals, policymakers, regional and international partners, community advocates, and countless mothers and families who place their trust in our healthcare system. For a small island nation such as ours, this is a tremendous achievement, one that demonstrates that excellence is not determined by size, but by vision, commitment, and action. To officially begin our ceremony, I invite Reverend Desiree Johnson of St. Monica's and St. George's Anglican Church to lead us in prayer. Reverend Johnson.
Good morning to you all. Let us pray. Almighty and everlasting God, source of all life, health, and hope, we give you thanks for bringing us together on this day to celebrate the validation of the Turks and Caicos Islands for the elimination of mother-to-child transmission of HIV and Hepatitis B. We praise you for the dedication, wisdom, and the perseverance of healthcare workers and policy makers, community leaders, mothers, families, and all who have labored faithfully toward this achievement. Through their service, countless children have been given the opportunity to begin life free from these infections, and families have been strengthened in health and dignity. Grant, O Lord, that this milestone may inspire these islands to continue the work of justice, compassion, and healing. Help us never to grow weary in caring for the vulnerable, supporting those affected by disease, and ensuring that every mother and child receives the care they need to flourish. Bless this ceremony and all who participate in it. Guide our deliberations, strengthen our partnerships, and direct our efforts toward a future where all people may enjoy the fullness of life you intend for them. We ask these things through Jesus Christ our Lord, who came that all may have life and have it abundantly. Amen.
Thank you, Reverend Johnson. Ladies and gentlemen, please be upstanding as we welcome students of the Thelma Lightman Primary School who will lead us in the national anthem and the national song.
and Caicos, Turks and Caicos, our country firm and free. Our allegiance, Turks and Caicos, we pledge and we affirm. We stand with courage brave to maintain this land of ours. With islands scattered here and there, with trust in God we stand. Turks and Caicos, Turks and Caicos, our country firm and free. Our allegiance, Turks and Caicos, we pledge and we affirm. Our allegiance, Turks and Caicos, we pledge and we affirm.
Thank you very much. Please be seated. And let me hear you say thank you to the Thelma Lightman Primary School. You know, in my protocol, because she's right in front of me and she's been our helper for so long, I omitted Miss Sandra Jones. Thank you so much for being here with us. Miss Jones is the technical advisor, PAHO technical advisor for the Caribbean and the EMTCT Secretariat. Welcome. Thank you so much for joining us. As we begin our program, it is fitting that we first hear from one of our key partners in this remarkable journey. The Pan American Health Organization and World Health Organization have been steadfast partners in strengthening healthcare systems throughout the region and have worked closely with the Turks and Caicos Islands in achieving this milestone. Please join me in welcoming Dr. Eldona Bisson, PAHO WHO representative for the Bahamas and the Turks and Caicos Islands. Dr. Bisson.
Good morning. Protocol having already been observed. Good morning to distinguished guests, partners, colleagues, ladies and gentlemen, members of the media. On behalf of the Pan American Health Organization and World Health Organization, I extend a warm welcome to you all. I have to also add that I'm bitterly disappointed that I cannot be there with you today on this important occasion. When I got to the airport yesterday morning and discovered my flight had been canceled, my heart dropped a little bit. But I'm with you in spirit and I'm with you virtually. And it's an immense pleasure for me to be with you here, albeit virtually, at this really important ceremony marking the certification for the elimination of mother-to-child transmission of HIV/V and hepatitis B in Turks and Caicos Islands. And this ceremony is doubly special, as Turks and Caicos Islands is the very first in the Americas to be certified for elimination of mother-to-child transmission of hepatitis B. I think you really should give yourselves a big round of applause for that. We're honored here today to be joined by national leaders and partners who've guided and supported this journey. And your presence here today underscores the importance of collaboration and collective action in advancing public health. It reflects the shared commitment that has made this great achievement, this moment here, possible. Today's gathering is both a celebration and an opportunity. It's an opportunity to reflect on the work that's brought us here today, to recognize the systems and partnerships that sustain progress, and to reaffirm our shared responsibility to protect the health of mothers and children. Today, we celebrate lives protected, futures secured, and a territory that has shown what leadership in public health looks like. Let's continue to carry this momentum forward, not only to sustain these gains, but to advance broader goals in maternal and child health, in HIV, and in hepatitis B prevention and universal health coverage. Big congratulations to Turks and Caicos Islands again on this remarkable achievement. And PAHO WHO remains committed to standing with you as you continue to build healthier, more equitable future for all. Over the course of this ceremony, we will hear reflections from leaders and partners, and we will formally acknowledge this important public health milestone. We hope this event also serves as a space for connection and for renewed commitment as we look to the future. So I invite you to enjoy today's program and to join us in recognizing not only this achievement, but also the dedication and hard work that made it possible, as well as the ongoing work that lies ahead to sustain it. So once again, big hearty congratulations to Turks and Caicos Islands on this magnificent achievement. I thank you all for being here, and again, a warm welcome to you all. Thank you so much.
And our thanks to you, Dr. Busson. Did you hear that? The first in the region. Did that hit you? Yes. Every great achievement is built upon vision, planning, and execution. Behind today's success stands a dedicated team of public health professionals and administrators who have worked tirelessly to ensure that every mother and every child receive the highest standard of care. We now hear from the leaders within the Ministry of Health and Human Services. Please help me welcome Mrs. Desiree Lewis, Permanent Secretary in the Ministry of Health and Human Services.
Good morning, everyone. It's indeed a pleasure to be here. Observing the established protocol, again, I say good morning. It is my honor to welcome you to this official occasion, marking the handover of the EMTCT validation certification and the elimination of hepatitis B, as was said earlier, the first in the Americas, and it deserves a round of applause. I'm very proud of my team, very proud. This occasion represents an important step in the continued of our national health services. It reflects the strengthening of key systems across maternal and child health, including service integration, routine screening, treatment delivery, and follow-up care. From a management, administrative, and operational perspective, this process has required structured coordination, adhere to established protocols, and ongoing monitoring to ensure that standards are consistently applied across all levels of care. It also highlights the importance of reliable data systems in tracking performance and supporting informed decision-making. This milestone has been supported by the efforts of technical teams across the Ministry of Health, including program management, clinical services, laboratory operations, and surveillance. This collective work has contributed to improving system efficiency and maintaining the quality of services delivered. We also acknowledge the collaboration of regional and international partners, including WHO, PAHO, UNICEF, and UNAIDS, and the Regional Validation Committee, whose technical support has contributed to capacity building and system strengthening. Additionally, we recognize the role of our local stakeholders. We could not have done it without our local stakeholders. And to them, I say thank you. and community-based organizations in supporting service, access, and community engagement. As we proceed with today's program, it's important to note that this validation reflects a structured and comprehensive assessment of systems already in place. Maintaining these standards will require continued coordination, oversight, commitment across all levels of the health sector. It is therefore my pleasure to also join in welcoming you once again, and I trust that today's proceedings will be both meaningful and reflective of the work undertaken to achieve this important milestone. Thank you very much for being here today.
Thank you very much, P.S. Lewis. You know, for all that she's learned in the Ministry of Health now, she only needs to sit her MBBS and she'll be okay. Thank you so very much for all that you've done to give us this achievement. Our next speaker is a medical professional herself and has played a critical role in guiding health policy and strengthening healthcare delivery across the Turks and Caicos Islands. Ladies and gentlemen, please join me in welcoming Dr. Nadia Astrid, our Chief Medical Officer.
Good morning, everyone. Following the established protocol, it is my great pleasure to deliver brief remarks on this truly momentous occasion for the Turks and Caicos Islands. Today marks a historic milestone for our country and for public health across the region. We gather to celebrate the validation of the elimination of mother-to-child transmission, or EMTCT, of HIV and hepatitis, an exceptional achievement that reflects years of unwavering commitment, collaboration, compassion, and perseverance. We are also deeply honored to be the first country in the region to achieve validation for the elimination of mother-to-child transmission of hepatitis B. For a small country such as ours, this recognition is not only a national accomplishment, but also a powerful reminder that size does not determine impact. What matters is vision, determination, and the steadfast belief that every mother and every child deserves the opportunity to a healthy start in life. This achievement means that babies born in our country now have a dramatically improved chance of entering the world free from HIV and hepatitis B. It means fewer families affected by preventable illness, fewer lives lost, and stronger, healthier communities for generations to come. It reflects the strength of our health system and our collective commitment to equity, prevention, and quality care. But today is also about people. It is about the healthcare workers who serve tirelessly in clinics, hospitals, and communities, the nurses, midwives, physicians, laboratory and surveillance teams, and partners who work day and night to ensure that no mother or child was left behind. It is about the mothers who trusted our health system and sought care early. It is about families and communities who supported them. And it is about the national, regional, and international partnerships that strengthened our response and kept us moving steadily towards this goal. To every member of the team, I thank you. Your dedication has transformed vision into reality. You have demonstrated that excellence in public health is achievable when people work together with purpose, discipline, and compassion. This validation belongs to all of you. This achievement builds on years of foundational work, and I must take a moment to recognize our predecessors whose efforts and leadership laid the groundwork for this success. I also acknowledge the critical contributions of the leadership team within the Ministry of Health, including the Health Promotion and Advocacy Unit, the Primary Healthcare Team, the National Public Health Laboratory, the National Epidemiology and Research Unit, our local healthcare partners, the TCI Hospital, private sector clinics, the Wellness Foundation, our visiting specialists, and many others whose names may not be mentioned, but whose impact is felt deeply. We also recognize the crucial role of the Pan American Health Organization, which has supported this journey every step of the way through technical guidance, capacity building, and sustained partnership. And particular, I should recognize our PWR, Dr. Eldona Boisson, for her leadership, and Ms. Jones for her tireless support. We extend further appreciation to our development partners, including the India-UN Development Partnership, for their invaluable contributions in providing equipment, facilitating training opportunities, and supporting the validation mission to the Turks and Caicos Islands. I should also thank the Regional Validation Committee for coming to the TCI. This has truly been a collaborative effort, with our clients and communities at the heart of this achievement. At the same time, we recognize that validation is not the end of the journey. It is a call to sustain and strengthen our efforts. We must continue to reinforce antenatal care, ensure universal access to testing and treatment, strengthen surveillance systems, and protect the gains we have worked so hard to achieve. Sustaining elimination requires vigilance, investment, innovation, and sustained commitment. It also requires us to address stigma, reduce inequalities, and ensure that the vulnerable populations continue to receive care and support that they need. This milestone also provides a strong foundation for broader progress. The systems, partnerships, and expertise developed through this effort can help strengthen maternal and child health services, improve infectious disease prevention, and advance our progress towards universal health coverage and a healthier society. Today, our country stands as an example of what is possible. We have shown that even a small island nation can inspire, lead, and achieve outcomes of global significance. We have demonstrated that with commitment, evidence-based action, and collective effort, elimination is not only merely an aspiration, it is achievable. Let us celebrate this moment with pride, but also with renewed determination. May this achievement inspire us to continue striving for excellence in healthcare, to protect the health of every mother and child, and to leave a legacy of hope, resilience, and progress for future generations. Congratulations once again to the entire team, and thank you all for your extraordinary dedication to this historic accomplishment. Thank you.
Thank you very much, Dr. Astrid. We're all very proud of you and your team, and we are indeed a grateful nation. Thank you very much. Next, we're also honored to receive remarks from the regional leadership of the Pan American Health Organization, PAHO. Please direct your attention to the screen for remarks from Dr. Rhonda Seeley-Thomas, Assistant Director of PAHO WHO.
Thank you, Madam Chairperson, and please permit me to adopt the protocols that you already established. Good morning to everyone. It's a privilege to join you today for this important moment of recognition as we celebrate the validation of the Turks and Caicos Islands for the elimination of the mother-to-child transmission of HIV and Hepatitis B. As the Assistant Director of PAHO, with responsibility for all technical areas, including communicable disease that include HIV and hepatitis, I extend sincere congratulations to the government and people of the Turks and Caicos Islands, to the Ministry of Health and Human Services, to health professionals across the islands, to civil society and community partners, and to everyone who sustained commitment and contributed to this achievement. This truly represents a historic milestone. The Turks and Caicos Islands is the first territory in the region of the Americas to be validated for the elimination of the mother-to-child transmission of hepatitis B. Permit me to remind you that there are 14 countries in Latin America and the Caribbean that have been validated for the elimination of mother-to-child transmission of HIV, 13 from the Caribbean and 1 from South America, Brazil. The Turks and Caicos Islands is the only country to be validated for EMTCT of hepatitis B. This distinction truly gives today's celebration significance, not only for the territory, but for our region as a whole. This achievement sends a clear message. The elimination of the mother-to-child transmission of hepatitis B is possible. It can be achieved when countries and territories maintain robust immunization systems, ensure access to quality antenatal care, integrate screening and preventive interventions into routine services, and leverage data to guide decision-making and document progress. This validation also recognizes the elimination of mother-to-child transmission of HIV, an achievement that reflects sustained antenatal HIV testing, timely access to treatment, continuity of care for pregnant women living with HIV, and systematic follow-up of infants exposed to HIV. What we celebrate today reflects years of steadfast commitment of healthcare workers, strategic investment, and effective collaboration. It reflects a health system that has consistently placed women, infants, and families at the center of care. A key factor underpinning this success has been the integration of health services. The Turks and Caicos Islands has demonstrated the importance of a coordinated, systems-based approach, ensuring that women are screened, infants are protected, and health services respond across the continuum of care. The role of immunization has been equally critical. The hepatitis B birth dose remains a critical intervention to prevent infection early in life, with its full impact achieved when administered at birth and followed by a complete infant vaccination schedule. The experience of the Turks and Caicos Islands demonstrates how a strong immunization program can serve as a foundation for elimination. This achievement also underscores the importance of accessible and equitable health services. Elimination depends on reaching all women and children, including those who may face barriers related to geography, migration status, language, financial constraints, or situations of vulnerability. Information systems and the availability of programmatic data are also essential. In many settings, hepatitis B elimination has been difficult to document, even where prevention services are strong. The experience of the Turks and Caicos Islands demonstrates that progress can be measured when routine health services generate reliable data and when programs are able to follow mothers and infants across the continuum of care. For the Caribbean and for the region of the Americas, these achievements represent an important example that I hope other countries and territories follow. It shows that elimination goals are within reach when political commitment is accompanied by organized services, sustained immunization, equitable access, and sound programmatic monitoring. At the same time, validation does not mark the end. It is a milestone that must be protected by maintaining high-quality maternal and child health services, sustaining strong vaccination performance, ensuring timely screening, treatment, and follow-up, and reaching all populations, leaving no one behind. Today, we celebrate the Turks and Caicos Islands and a historic first for the region of the Americas. We mark a public health achievement that will help protect future generations and recognize the leadership, dedication, and collective effort that made this possible. The Pan American Health Organization is honored to have accompanied this journey and reaffirms its commitment to supporting the Turks and Caicos Islands and all countries and territories of the region as they sustain these gains and continue towards advancing broader elimination goals. Thank you for your attention.
And our thanks to you, Dr. Seeley Thomas, Assistant Director at PAHO. Ladies and gentlemen, every certificate has a story behind it. The story of EMTCT in the Turks and Caicos is one of resilience, collaboration, and commitment. It is a story that spans years of planning, testing, treatment, counseling, monitoring, and care. Let's now take a look at that journey. Please direct your attention again to the screen for a video, Achieving EMTCT of HIV in the Turks and Caicos.
Turks and Caicos, similar to other countries in the Americas, they apply to PAHO for the validation of the mother-to-child transmission of either HIV, syphilis, or hepatitis B. Following the in-country process, the reports are shared with the regional validation and the global validation committee to determine if the country met the criteria, the global criteria for the elimination of the mother-to-child transmission of any of these diseases.
I can confidently say that our journey toward the elimination of mother-to-child transmission has taught us invaluable lessons, and lessons that extend far beyond our clinical protocols.
Is that on admission, we have the admission process. We do rapid tests or point of care testing, as we call it, of HIV, syphilis, and hepatitis B. So upon discovery of a positive test for either HIV, syphilis, we implore the immediate treatment.
So health professionals are key. We are central to ensuring that pregnant mothers, new mothers, receive comprehensive, respectful, and timely care. Their role begins with first ensuring that we're doing prompt identification of various illnesses such as HIV, syphilis, and hepatitis B.
Every pregnant mother that comes to the clinic is being screened for HIV on her first antenatal visit. If a woman tests positive at any point, we immediately confirm the results and start antiretroviral therapy.
We've also seen how important it is to have strong systems so we can track progress and respond quickly. These lessons will help us to work together to eliminate other diseases and strengthen our clinical services. We're committed to using what we've learned to keep improving and making sure every child in TCI has a healthy start in life.
One of the most important takeaways is the power of integration and collaboration. Progress happens when our entire healthcare system, from policy to patient care, moves in the same direction.
Beyond healthcare, sectors such as education, social services, and community-based organizations have played essential roles. Public education campaigns, community engagement, reduction of stigma and discrimination, and support systems for vulnerable populations have all contributed to increased uptake of services and adherence to treatment.
I am so happy that the process has started, because I was the person who started the process of compiling information. And I'm so happy that this process has started for validation to take place.
We have been on this journey since 2016, and it took a lot of effort from stakeholders, both within the primary, secondary healthcare services, as well as community stakeholders and community partners across the length and breadth of the Turks and Caicos Islands.
This recognition means that our health system is strong and capable. It shows that we are serious about protecting our families and investing in the future of our children. But we know that it doesn't stop here. We're continuing to improve on how we track and follow up with babies and mothers, making sure that these services are easily accessed. Also, we're keeping sure that our health workers are trained and supported.
Our commitment is not just clinical, it is promised to every child born in the Turks and Caicos to start life free of preventable infections. From 2013 up to today, I can tell you, I haven't come up with a child to say that is HIV positive.
But it is also a testament and a commendable example that we are working like a well-oiled machine for every person who resides within the Turks and Caicos Islands, and that we can be an example to others. You can do it too.
Together, we have found an approach that we feel would provide a comprehensive solution to the needs of all of these mothers here in the Turks and Caicos Islands. I'd be very proud of the team, and I'd like to say congratulations to all who have worked tirelessly over the past 9 years towards the achievement of this validation.
This achievement is truly momentous. It represents a major milestone for public health and for the global HIV response, marking an important step towards our shared goal of ending AIDS among children by 2030.
This achievement reflects strong political will and steady investment in primary health care. It also recognizes the dedication of health teams, and of people living with and most affected by HIV, who work every day to ensure babies are born free of preventable infections.
This is a major public health achievement and a testament to what can be accomplished through focused leadership, science-driven policy, and strong community solidarity. Today, we celebrate not only the elimination of HIV infections in infants, but also an extraordinary milestone.
As chair of the National Validation Committee, receiving WHO certification for EMTCT is a significant milestone and a testament to the country's commitment to public health excellence. It reflects the dedication of health workers, policymakers, and communities working collaboratively toward a common goal. At the same time, certification is not the endpoint, but a responsibility to sustain gains, maintain high standards, and continue strengthening systems to prevent re-emergence. It serves as both the recognition of achievement and motivation to advance further within the elimination agenda.
I feel incredibly proud. This is a major achievement for the Turks and Caicos Islands. This shows what is possible when persons work together and we protect mothers and babies. The journey hasn't been easy, but we've done everything to make sure that the follow-ups and appointments were made. And we are proud to know that we haven't had any babies infected with HIV within the last decade. So it just speaks to our commitment as a government to work together.
And we have to give everybody involved in this process credit, because they have all worked hard and they should all pat themselves on the back. They've done a very good job. Congratulations.
I'm sorry, I missed your applause. What we've just witnessed is a powerful reminder that behind every statistic is a life changed, a family protected, and a future secured. The success of the Turks and Caicos Islands has attracted recognition from partners across the region and around the world. We begin with congratulations from UNICEF. Please direct your attention again to the screen for the remarks from Ms. Anurita Baines, Associate Director of HIV/AIDS, UNICEF.
Distinguished guests, colleagues, and friends, it is my great honor to join you today. My name is Anurita Baines. I'm the UNICEF Global Associate Director for HIV/AIDS, and I bring warm greetings on behalf of UNICEF. Today we gather to celebrate an extraordinary achievement. With deep admiration, we extend our heartfelt congratulations to both the governments of Bahamas and the Turks and Caicos Islands for their remarkable success. The elimination of vertical transmission of HIV in the Bahamas and the elimination of vertical transmission of HIV and hepatitis B in the Turks and Caicos Islands. This achievement is truly momentous. It represents a major milestone for public health and for the global HIV response, marking an important step towards our shared goal of ending AIDS among children by 2030. Your achievement reflects what is possible when health systems are strengthened, when communities are engaged, and when every pregnant woman is supported with testing, treatment, and care. It ensures that newborns begin life HIV-free with the promise for a healthier future. Latin America and the Caribbean has long been a beacon of progress in this global effort. From Cuba, the first country in the world to be certified, to Brazil's certification last year, and now to the Bahamas and the Turks and Caicos Islands. The region continues to lead with ambition and determination. Today, more than half of all countries and territories that have achieved elimination are from this region. This is a legacy of leadership that inspires the world. And at a time when global health faces competing priorities, constrained resources, and growing complacency, your success stands as a powerful reminder. Ending AIDS among children is not only possible, it is happening. You have shown that eliminating one disease strengthens an entire health system. The lessons from your journey illuminate a path toward resilient primary health care, strong community systems, and data-driven action that transforms lives. This is how we walk the last mile. This is how we ensure that every mother, every adolescent girl, and every child is reached and supported and empowered. To all those in the Bahamas and Turks and Caicos Islands who contributed to this achievement, healthcare workers, community leaders, government officials, partners, donors, and the UN family, please accept our warmest congratulations. UNICEF is proud to stand with you, proud to learn from you, and proud to continue this journey with you. Together, we move closer to realizing a region and a world where no child is born with HIV, syphilis, or hepatitis B. Together, we can build a future where every child thrives. I thank you.
And our thanks to UNICEF as well. Also virtual is a message of congratulations from Ms. Louisa Cabal, Regional Director of UNAIDS.
Good morning, distinguished guests, respected dignitaries, partners, communities. I acknowledge your presence, all protocols observed. I am delighted and honored to join you for this certification ceremony. On behalf of our Executive Director, Ms. Winnie Bianima, and the entire UNAIDS, I congratulate the Turks and Caicos Islands on eliminating mother-to-child transmission of HIV and hepatitis B. Today, the Turks and Caicos Islands becomes the 13th country in the Caribbean to be certified by the WHO for achieving this significant public milestone. Your commitment and determination and your efforts have ensured that expectant mothers are routinely tested and given antiretroviral drugs to protect themselves so they can stay healthy and their babies can be born free of HIV. The Caribbean has the enviable record of leading the world in eliminating mother-to-child transmission of HIV because out of 23 certifications globally, almost 60% come from this region. Big congratulations. The elimination of vertical transmission, as we have heard today, is no small feat. This has played a significant role in the reductions of new infections by 21% in the Caribbean that have occurred in 2010, since 2010. UNAIDS as a partner recognizes and commends PAHO for its leadership in driving the regional elimination agenda and supporting countries through its elimination platform. Importantly, the certification comes as the world pushes to end AIDS as a public health threat by 2030. Therefore, we should never lose sight of the fact that women can test early in pregnancy, start treatment quickly, and stay in care, and that every child has a better chance of being born free of HIV. Today is a reminder that this is possible, and that while we experience significant challenges here and across the rest of the Latin America and the Caribbean, we can end AIDS in the Americas. The successes we're celebrating here today are the result of tireless efforts of political leaders, frontline workers, health officials, communities, including people living with HIV, and the development partners. We are therefore here to celebrate all of you and witness this certification because there is a political will for steady investment in primary health care and the work of health teams and people living with and most affected by HIV to ensure that our babies are born free from preventable injections. The Turks and Caicos Islands, and indeed the rest of the Caribbean, have set the tone, have demonstrated that when we collaborate within and across sectors, we can achieve these public health milestones that safeguard the health and well-being of everyone. Partnership, as we also heard this morning, is a central component of the Global AIDS Strategy 2026-2031. This strategy, just adopted last December, puts a lot of emphasis on this and encourages that governments, people living with and most affected by HIV, NGOs, academics, media, and other stakeholders work together to prevent new infections and put and retain people on treatment, as well as safeguard human rights. This is what it took to achieve this certification and what is required for us to end AIDS as a public threat in our region. I also want to say that as we prepare for the 2026 UN high-level meeting on HIV/AIDS in New York later this month, where heads of state and government, ministers, communities will agree to a new political declaration, this certification ceremony is a timely reminder that when we work together, we can achieve great public health outcomes. And I hope that your voice will be heard in New York later this month. The Caribbean response has shown that progress is possible when HIV services are grounded in human rights, sexual and reproductive health, gender equality, and community leadership. This must remain central to the next political declaration and not treated as optional add-ons. The high-level meeting is an opportunity to ensure that the whole of the Caribbean region's realities, progress, solutions are visible and heard and reflected in these global commitments. I hope this region goes to this process with a clear voice, aligned with the Caribbean Regional Strategic Framework and the Global AIDS Strategy to mobilize financial commitments for the region and indeed all countries to end AIDS by 2030. We encourage the government of Turks and Caicos Islands to ensure continued investments jointly with all partners to protect the achievements that we are celebrating today. This means stronger integrated maternal, newborn, and child health services, reliable access to quality assured medicines, diagnostics, and supplies, actions to tackle stigma and discrimination, and support to community-led responses that help women and families stay connected to care. Congratulations, and you can count on UNAIDS to continue to be a partner along this journey. Thank you very much.
Thank you, Ms. Cabal. And we're going to continue, and we're pleased to hear from Ms. Wendy Telk Emanuelson, Executive Director of PANCAP.
CHIP against HIV and AIDS, PANCAP. I'm delighted to congratulate the government and people of the Turks and Caicos Islands on this remarkable achievement, the elimination of mother-to-child transmission of HIV and hepatitis B. This is a proud moment for you and for the entire Caribbean. I would like to congratulate you on the number of government officials. While I was listening to the welcome and those that we're bringing remarks, I realized that we have a number of government officials, ministers, religious leaders, representatives of civil society organizations, and other stakeholders in the room. And your presence sends a powerful message that health is not solely the responsibility of the health sector, but a shared responsibility across all sectors of society. This achievement also supports the vision of the Caribbean Regional Strategic Framework 2026-2030, which calls for a Caribbean where everyone has access to quality health services and where we continue working towards ending HIV as a public health threat. I would also like to express our sincere appreciation to PAHO for its continued technical support and leadership across the Caribbean in collaboration with UNICEF, with UNAIDS, and the support of the government of India. And special thank you goes to Ms. Sandra Jones. Sandra, your commitment, technical expertise, and persistence have helped make this achievement possible. Congratulations once again to the Turks and Caicos Islands, and thank you to all partners who helped make this day possible. I thank you.
Okay, I think we're ready now to welcome our next speaker, Dr. Dion, Chairman of the Regional Validation Committee.
And I'm so honored to be with you all today. I'm sorry I'm not there with you in person, but as chair of the Regional Validation Committee, I wanted to share a few thoughts in addition to my congratulations. One is about these wily infections, and the other is about the process that we go through for validation. So the reason these infections are an area of focus is they are smart. Most people with these infections don't know they have them. They're entirely asymptomatic. A pregnant woman may have no idea that she's living with HIV or hepatitis B or has syphilis. And we know how easily they pass across the placenta and the risk that poses to the pregnancy. The importance of EMTCT that you all have demonstrated is that you need to have a system in place that does 1,000 steps correctly, to make sure that there's early access to care, to make sure there are good quality tests available to test the pregnant woman at more than one time point, to make sure that the treatment is available wherever she's presenting for care, and to ensure that the infant has follow-up at the right time with the right tests to be sure that the baby is healthy and did not pick up an infection. This requires an aggressive approach and a real commitment from every level of the health ministry on down to the community in recognizing the importance of these efforts. So our challenge is clear. The pathogens are going to stay challenging for us, and you all have dedicated and commitment that is manifested by this EMTCT certification that you have earned. A word about the process. It was mentioned by someone already that this was initially started back in 2016. You all have been working on health policies to protect women and infant and families for decades, but the validation process has literally been ongoing since 2016 to get to where we are today. This involved the creation of a report that included 5 years of comprehensive data from 2020 to 2024 with indicators that are very specific about the testing, about the treatment, about human rights, about access to care, all the critical components that we know need to be there to get EMTCT to be successful. We received your report at the end of 2025. There was a virtual team and then an in-country mission to validate and make sure that when we talk to pregnant women in Turks and Caicos, that they told us the same thing that was written in the report, and they did. When we talk to nurses and doctors on the front line in different regions, can they validate and agree that the testing is available and the treatment is done as quickly as possible? And they did. So we were very, very impressed. Having reviewed a lot of reports as part of the Regional Validation Committee, I can share with you, it is not common to see something like that is in the TCI report with 100% testing of pregnant women in ANC, 100%, every single one tested, every single one treated. And for hepatitis B, the same thing, 100% surface antigen testing for women in pregnancy and 100% receipt of the birth dose vaccine for infants. These are the indicators that lead to the outcomes we care about, but these indicators take a lot of energy and effort and commitment that's been demonstrated today. So I applaud you. We will continue to look to TCI as a leader in the field. Other regions are trying to match and do some of the things that you're doing to be able to reach the successes that you have. We know how much energy and effort it takes. We applaud you, and we're very impressed by you. And a special shout out, has been said a few times, to Sandra Jones. She's not only in the front of the pack for our committee, but behind the scenes, literally on a daily basis for all these 10 years, supporting TCI and making sure that everything is in line to support this validation effort. So again, I extend my congratulations to all of you, and very impressive work. Thank you.
And to you, Dr. Dion, and your team, thank you very much. Please direct your attention again to the screen for remarks from Dr. Jabas Barbosa, the Director of the Pan American Health Organization. Dr. Barbosa.
On behalf of the Pan American Health Organization, PAHO, I extend congratulations to the Turks and Caicos Islands on the historic certification of the elimination of mother-to-child transmission of HIV and hepatitis B. This is a major public health achievement and a testament to what can be accomplished through focused leadership, science-driven policy, and strong community solidarity. Today, we celebrate not only the elimination of HIV infections in infants, but also an extraordinary milestone. Turks and Caicos Islands is the first country in the Americas to receive official certification from the World Health Organization, WHO, for the elimination of mother-to-child transmission, important public health challenge nowadays. To the healthcare professionals, including doctors, nurses, midwives, laboratory staff, vaccination teams, community health workers, program managers, and support staff, as well as outreach workers, civil society, organizations, and national partners. Your dedication, skill, and compassion made this achievement possible. You ensure mothers received testing, counseling, and treatment, and infants received timely vaccination and follow-up care, delivered with quality, respect, and equity. Through your collective efforts, you strengthened health services, protected families, and helped turn policy into action. This achievement reflects strategic leadership by the Ministry of Health and Human Services, supported by a strong public-private partnership across the health sector and civil society. As we look ahead, this milestone should inspire continued investment in maternal, newborn, and child health, stronger health systems, and progress toward eliminating other communicable and neglected diseases. Once again, congratulations on this outstanding accomplishment, and particularly for the leadership of the Ministry of Health. PAHO reaffirms our commitment to continue working alongside with the government and people of the Turks and Caicos Islands, supporting efforts to sustain these gains and advance toward the elimination of additional public health threats. Thank you.
And we say thank you to the Director of PAHO, Dr. Barbosa. Now, we know you've been sitting still for quite some time, so we're going to get you moving your legs and arms, no doubt. And what better way to display our pride today than with our culture? Ladies and gentlemen, a cultural presentation. The culture of the Turks and Caicos Islands on full display. And this entire front row to my right, I only saw feet stamping. And I could have taken bets. If there was only one person who was going to stand and move, it would have been the Honorable Sean David Malcolm. Of course, he was upstanding. We're grateful for that cultural presentation. Ladies and gentlemen, we've arrived at the defining moment of today's ceremony. This certificate represents years of work. It represents the dedication of doctors, nurses, midwives, lab professionals, public health teams, community health workers, policymakers, and development partners. It represents mothers who sought care, who trusted the healthcare system, and a nation committed to future generations. Most importantly, it signifies that babies in the Turks and Caicos Islands can enter the world free from HIV transmitted from their mothers. To formally present the certification of the elimination of mother-to-child transmission of HIV, I invite Ms. Sandra Jones, PAHO Advisor for the Caribbean and EMTCT Secretariat. And to receive the certificate, I'm going to invite the Minister of Health and Human Services. Please join me in congratulating the Turks and Caicos Islands on this extraordinary accomplishment. Accepting this prestigious certification on behalf of the government and people of these islands was the Minister of Health and Human Services, the Honourable Kyle Knowles. We now invite the Honourable Minister to make his remarks. Honourable Knowles.
Good morning, everyone. On the established protocol, good morning. It's with great honor and deep appreciation that I accept on behalf of the Turks and Caicos Islands this recognition of the country's achievement in the elimination of mother-to-child transmission of HIV and hepatitis B. Today marks a moment of immense pride, not only as a significant milestone, but as a reflection of what we have worked together to achieve through commitment, collaboration, and a sustained effort. This validation confirms that we have not only met the global standards required, but that our health system and services are delivering meaningful results for the people that we serve. We are especially proud to be the first country in the region to achieve the elimination of mother-to-child transmission of hepatitis B. This distinction speaks to the dedication, consistency, and the focus that have guided our nation's response and demonstrate what is possible when public health remains a national priority. This recognition is more than a technical success. It is a victory for our people and a testament of the healthcare system that continues to strive for our quality, equity, and impact. As we accept this certificate, we do so on behalf of the many individuals and partners whose contributions made this accomplishment possible. We acknowledge our nurses, midwives, doctors, and frontline healthcare teams, whose unwavering commitment ensures quality care at every stage of the health journey. We also recognize our laboratory professionals and our public health and surveillance teams, whose expertise underpin the strength, reliability, and success of our systems. We extend our sincere appreciation to our community partners, including the TCI Health and Wellness Foundation, Gender Affairs, and the faith-based organizations. Through their achievements or through their engagements and trusted presence, they have strengthened our reach and amplified our impact across communities. We are equally grateful to our regional and international partners, World Health Organization, PAHO, UNICEF, UNAIDS, and the Regional Validation Committee for their continued technical support, guidance, and collaboration throughout this process. This achievement reminds us that success is built on relationships, perseverance, and a shared commitment to improving the health and well-being of our people. While we proudly accept this validation, we do so with a clear understanding of the responsibility it brings. We remain steadfast in our commitment and sustaining these gains, strengthening our systems, and ensuring that every mother, every child continues to build and benefit from the high-quality, equitable, and accessible health care. So today, we accept not only a certificate, but we also a renewed commitment of excellence. Together, we will build upon the achievement, continue advancing the healthcare of our nation with purpose, determination, and hope. And before closing, I just want us to really acknowledge the Ministry of Health, because as the Minister of just over a year, I must say that you wouldn't find a more dedicated, committed, and hardworking team like the Ministry of Health. So please give them a round of applause. And I'm sure my PS wouldn't like this, but she is really a significant driving force behind a lot of what we see the Ministry of Health achieving today. So we want to give her a round of applause. So in closing, I just want to say thank you all for being here. Thank you for your continued support, and may God bless these Turks and Caicos Islands. Thank you.
I don't think we can find a more proud minister in government today than the Minister of Health and Human Services. Ladies and gentlemen, to reflect on this significant accomplishment is our country's leader and leader of the government of the Turks and Caicos Islands, the Honorable Charles Washington Mizik. Please rise as we welcome the Premier.
You may be seated. Good morning, everyone. Recognizing the protocol that's already been established, and to those dignitaries who may have come in late, again, good morning. Distinguished guests, esteemed partners, members of the healthcare community, ladies and gentlemen, today is a proud and defining moment in the history of the Turks and Caicos Islands, as we've heard from so many of our previous speakers. We gather not only to celebrate a remarkable public health achievement, but to recognize what this milestone says about who we are as a people and what we are capable of achieving together as a nation. So, teamwork, finish it, makes the dream work, right? The validation of the elimination of mother-to-child transmission of HIV and hepatitis B is an extraordinary accomplishment to stand as the first country in our region to achieve validation for the elimination of mother-to-child transmission of hepatitis B is a distinction that fills us with immense pride and places the Turks and Caicos Islands among a select group of nations demonstrating global leadership in public health. The achievement represents far more than a health sector success. It is a national triumph. It reflects the strength of our institutions, the effectiveness of our partnerships, and our unwavering commitment to protecting the health and well-being of every mother, every child, and every family throughout these islands. It demonstrates that regardless of our size, we possess the vision, determination, and capacity to lead by example and set standards others may aspire to. Today's success did not happen overnight, as you've heard and you've seen. It is the result of years of dedication, strategic planning, and sustained investment. It was made possible by healthcare professionals whose compassion and expertise saves lives every day, by public servants who work tirelessly behind the scenes, by community organizations that helped build trust and awareness, and by individuals and families who embraced the services available to them and became active partners in safeguarding their health. So, to all who played a role in this achievement, I offer the sincere gratitude of the government and people of the Turks and Caicos Islands. I particularly commend the Ministry of Health and unwavering pursuit of excellence. I also extend our deepest appreciation to our regional and international partners, whose collaboration, technical support, and shared commitment have been instrumental in helping us reach this historic milestone. This achievement reaffirms an important truth. When governments, healthcare professionals, communities, and international partners work together with a common purpose, extraordinary results are possible. As a government, we remain steadfast in our commitment to strengthening our healthcare system, investing in our people, and ensuring that quality, accessible, and equitable healthcare remains available to all who call these islands home. While we celebrate this milestone today, we recognize that it is also a foundation upon which we must continue to build. Our responsibility now is to sustain these gains, advance new health priorities, and continue creating healthier and more resilient communities for future generations. Today, the Turks and Caicos Islands sends a powerful message to our region and to the world. Excellence is not determined by size of a nation, but by the strength of its vision, the resolve of its people, and the unity of its purpose. Let us celebrate this achievement with pride while looking ahead with confidence and ambition. For if we can accomplish this together, there is no limit to what we can achieve as a nation. So, in closing, may God continue to bless the Turks and Caicos Islands, and may He continue to bless the people whose dedication, resilience, and spirit make these islands strong. Thank you, and may God bless you all.
Thank you very much, Honourable Premier. We know you've had a busy start of your week already with events and calendar schedules, so thank you very much for taking the time out to be here with us this morning. The Governor of the Turks and Caicos Islands has consistently championed excellence in governance, development, and public health. Please be upstanding as we welcome Her Excellency Delaney Daniel Selvaratnam.
Good morning. Please be seated. Acknowledging the protocol established, I'd like to acknowledge the Premier, Cabinet colleagues, dignitaries who are joining us online, and all partner agencies who are also here with us. It is a privilege to join you today on this important national occasion as the Turks and Caicos Islands receives formal validation for the elimination of mother-to-child transmission of HIV and hepatitis B. As everyone has said, this is a proud and deeply meaningful milestone for our islands. It is, of course, a moment of recognition, but more importantly, it is a moment of reflection. Behind this certification lies years of sustained effort, careful planning, professional discipline, and an unwavering commitment to mothers, babies, and families across the Turks and Caicos Islands. The elimination of mother-to-child transmission stands amongst the clearest demonstrations of what a strong, coordinated healthcare system can achieve. When prevention, testing, treatment, care, and follow-up are delivered consistently and compassionately, the results are profound. It means that mothers are being reached. It means that babies are being protected. It means that services are working as they should and that data is being used intelligently to guide action. This achievement speaks to something far greater than a single program of recognition. It reflects the enduring value of investment in maternal and child health. It underscores the importance of accessible antenatal care, early screening, and trusted public health services. Importantly, it reminds us that behind every public health success are people: nurses, midwives, doctors, laboratory teams, community health workers, public health leaders, regional partners, and families, each playing a vital role. This achievement also reminds us that public health is, at its core, about how we care for one another. As has been observed, the true measure of any society can be found in how it treats its most vulnerable members. Today, that measure speaks strongly for the Turks and Caicos Islands. This validation also places the Turks and Caicos Islands within a wider regional and global movement to prevent the transmission of HIV and hepatitis B. For our archipelago of islands, this sends a powerful message that scale does not limit impact, that progress is possible when systems are strengthened, partnerships are purposeful, and human dignity remains at the center of national development. As we celebrate, we must be clear, validation is not the end of the journey. It is a standard to be sustained. The work of prevention, education, testing, treatment, and follow-up must continue with discipline and focus. Every mother, regardless of circumstance, income, or island, must have access to the care she needs. We must continue to foster trust and support families with dignity and respect. At the same time, we must recognize that HIV rates are rising, underscoring the need to build on this success, intensify our efforts to reduce stigma, expand awareness, and strengthen outreach so that more people are reached early and supported effectively. Public health success ultimately rests not only on policy, but on confidence. People must trust the system enough to seek care early. Mothers must feel supported, not judged, and communities must understand that prevention is powerful and early interventions save lives. Today's ceremony, therefore, is more than a presentation of a certificate. It is the reaffirmation of a collective commitment to protect mothers, to safeguard children, and to build a healthier future for all. Today, as Governor, I am pleased to join in recognising this important achievement for the people of the Turks and Caicos Islands. I offer my sincere congratulations to the Ministry of Health and Human Services, our healthcare professionals, PAHO, the World Health Organization, and all those whose dedication has made this possible. Could I ask everyone who's in the room who is from the Ministry of Health who has any involvement in achieving this to stand up so that we can properly applaud you and recognise you? Come on, don't be shy. Everyone stand up. Front row, stand up. Sandra, you should stand up. There we go. Okay. Thank you very much. May this milestone strengthen our resolve to continue building a health system that is resilient, inclusive, and responsive to the needs of every person across these islands. Congratulations.
Thank you, Your Excellency. Ladies and gentlemen, achievements such as this don't happen by accident. They are the result of leadership, commitment, partnership, and perseverance. To offer closing reflections and a vote of thanks, we hear from Dr. Camelia Clark, Director of the Health Promotion and Advocacy Unit and EMTCT focal point for the Ministry of Health and Human Services. Dr. Clark.
Good morning, everyone. Allow me to adopt the protocol that's already been established. I was just reminded to slow down and don't go too fast. It's a long list of persons to thank. It is indeed a privilege, nay, actually a pleasure, to offer the closing remarks and the vote of thanks for this very momentous occasion. As we bring this meaningful ceremony to a close, I invite us to reflect on the journey that brought us here today. The process of achieving validation has not been a sprint. It's actually been a marathon, requiring endurance, discipline, unwavering commitment. Along the way, sometimes it actually resembled a relay, where baton was passed from one set of hands to another across teams, services, and stages of care. Each contribution played a vital role in moving us to where we are today. Beyond systems and processes, the journey demanded something more. So let me start first by thanking the Almighty God for journeying mercies throughout the process. The process was actually built on long days that stretched into late nights, weekends dedicated to reports, reviews, preparation, and countless hours of work behind the scene. It reflects a level of commitment that goes beyond duty. It speaks to shared determination to see this through, to get it done, and to get it done well. At every stage of the race, individuals and teams step forward with purpose and precision. From policy to practice, from clinics to communities, from testing to treatment, every effort helped carry us to this important milestone. Along this journey, we didn't simply work towards validation, and this was important because the certificate is a big deal. We actually strengthened our health systems by improving coordination across services, enhancing screening and treatment pathways, reinforcing our data and surveillance system, and ensuring more consistent and high quality of care for those we serve. These gains will continue to benefit our people well into the future. We also recognize those persons that have been a part of this journey from 2016, from the very beginning. Members of the Turks and Caicos Islands Validation Committee have remained steadfast throughout, providing continuity, leadership, and guidance from the start. I would like to acknowledge my predecessor in this post, Ms. Eldora Robinson, who now retired, was present at the start of this very important work in 2016. Her early leadership and vision laid a strong foundation upon which this achievement was built. And although she's not here with us in the room, I'd like to give us a round of applause. I wish to extend sincere appreciation to our many teams who have carried this work forward. The maternal and child health team across the TCI hospitals and the primary health care department, the private sector, including doctors, nurses, midwives, public health nurses, managers, administrative teams, technical teams. But special mention goes out to Dr. Dawn Perry-Ewing, the Chief of Medical Services of the TCI Hospital, distinguished obstetrician and gynecologist. Dr. Stania Mati, stand please. Dr. Stania Mati, Deputy Chief of Medical Services and Pediatrician, and from our primary health care team, our primary health care manager, Ms. Alrisa Gardner. Our senior public health nurse, Nurse Savita Ramkelawan, affectionately Nurse Kelly. Our public health nurse and HIV focal point, Nurse Colleen Henry. Our HIV care and treatment team, including the members of the Health Promotion and Advocacy Unit, past and present, from our administrative officers to our program officers and our nurses. Our dedicated laboratory team from the Ministry of Health, including National Public Health Lab, past and present, Ms. Marissa Miller, Ms. Arlene Sibbs, and of course, Ms. Carol Robinson from the TCI Hospital. These persons have ensured precision, quality assurance, and commitment to timely and accurate testing, forming a critical backbone for this validation process. For our partners from the TC Health and Wellness Foundation, special recognition to Nurse Nora Tyndale. She was an early torchbearer starting in the Ministry of Health, and she's now retired from the Ministry of Health, but she has continued this tireless work ensuring quality care. And of course, from the leadership of the TC Health and Wellness Foundation, Executive Director, Ms. Anantha Jarvis. From our partners in the Gender Affairs, Human Rights Commission, a special mention to Ms. Carolyn Dickinson, and of course, members of the Attorney General's chambers who made sure that we are on the legal pathway. We are on the legal pathway to validation. And our private sector medical partners, our faith-based partners, our community partners, and importantly, our persons living with HIV, whose trust, resilience, and engagement remains central to everything that we do. Your collective commitment ensured that every handover of the baton was strong and steady. I also want to recognize the leadership and technical guidance provided in the Ministry of Health from Ministers of Health, past and present, specifically Dr. the Honorable Rufus Ewing, Honorable Edwin Aswood, Honorable Jamel Robinson, Honorable Erwin J. Saunders, Honorable Sean Malcolm, and of course, our present Minister of Health, Honorable Cal Knowles. And of course, I would be remiss if I did not mention our incomparable Permanent Secretary, Mrs. Desiree Lewis, OBE. Our Deputy Permanent Secretary, Ms. Renessa Williams. And of course, I cannot go without mentioning our former Deputy Permanent Secretary, who's now a Permanent Secretary, Mrs. Tamara Howell Robinson. And last but certainly no means the least, our Chief Medical Officer, Dr. Nadia Aswood. Your leadership and guidance has been instrumental throughout this process. And of course, we extend our sincere thanks to our regional and international partners, particularly WHO, Ms. Sandra Jones, who has been a steady guide throughout the journey, late nights, early mornings, weekends, holidays, Christmas holidays. We were on the phone working through the process, steady guidance throughout the process. And of course, Dr. Eldona Boston, our PAHO WHO representative. And I must make mention of the India-UN Development Partnership Fund, who has provided steady support for propelling these elimination initiatives within the Pan-American region. Of course, we must make mention of UNICEF AIDS and the Regional Validation Committee that provided steady support. They were able to visit the country, and despite many obstacles, they were able to confidently guide us through the process. Now, this list is long. At this time, I must acknowledge that the list of persons who have contributed to this achievement is quite extensive, and we'll be here all day. And while it is not possible to name everyone, please know that your contributions, whether it be visible or behind the scenes, is acknowledged, and it is valued and sincerely appreciated. Now, we're moving to the ceremony. As we reflect on today's ceremony, I would like to thank our incomparable Mistress of Ceremony, Ms. Cheryl Ann Francis Foreman, for guiding the program with professionalism and grace, the planning committee for their coordination and dedication, our technical teams from locally and PAHO for their seamless delivery, for photography services, or videography services as well, Genesis Next, and special mention because he's been with us through the extensive progress, late nights, early mornings, and weekends to make sure this process goes ahead seamlessly. Also, the Communications Directorate of the Turks and Caicos Islands government, the decorator, creating the setting that is befitting this milestone, the media for being here, for capturing the actual event. So we also want to extend special thanks to the students of the Thelma Lightburn Primary Schools who beautifully rendered the national anthem and songs. and of course to the dancers whose performance added vibrancy and cultural pride to the occasion. We want to also acknowledge and thank those who extended congratulatory remarks and support throughout the ceremony, including UNAIDS, UNAIDS, PANCAP, and the Assistant Director of PAHO. Our gratitude also extended to those who contributed to today's program, the Honorable Minister of Health, Her Excellency Governor Delaney Daniel Salvaratum. Yes, I said it right. The Permanent Secretary, Honorable Premier Charles Washington Mizik, the Permanent Secretary Mrs. Desiree Lewis, and Chief Medical Officer, as well as Reverend Johnson, opening appropriately with prayers. As we conclude, we recognize that while we have reached this important milestone, the race continues. The baton must move forward as we sustain these achievements and continue strengthening our systems for the future. Let us carry forward the same spirit of teamwork, commitment, and determination that has brought us to this point. Thank you all for your presence and your contributions. Safe travels. Enjoy the rest of your day, and may God continue to bless the Turks and Caicos Islands.
And our thanks to you, Dr. Clark, to you and your team for the work that you've done. Today, the Turks and Caicos Islands has demonstrated what is possible when vision meets action, and when healthcare is guided by compassion, science, and determination. It tells the world that the Turks and Caicos Islands is capable of achieving excellence at the highest international standard. History will record this day as one of the proudest moments in the evolution of healthcare in these islands. Congratulations to every healthcare worker, every policymaker, every partner organization, and every citizen who helped to make this possible. I'm going to invite our dignitaries and all the officials from the Ministry of Health and our stakeholders and partners to assemble in the front for a commemorative photograph. Immediately following the photograph, guests are invited to join us for a reception in the lawn to our left. Thank you for joining us in celebrating this remarkable achievement. Have a wonderful afternoon, and once again, congratulations, Turks and Caicos.